Hi, I'm Dr. Farhan Malikzadeh.
And I'm Dr. Parisa Malikzadeh.
And we are Sisters RI.
Thanks for joining us today. We're going to be talking about one of my favorite topics, cancer immunotherapy.
Okay, so what is cancer immunotherapy?
So cancer immunotherapy is the use of your own immune system to help fight cancer.
What is the immune system?
Immune system is essentially your body's defense system against foreign invaders, meaning things that don't belong in your body. And it includes fighting bacteria, fighting off viruses, and your immune system actually is involved in fighting off cancer too.
So how does that happen?
Normally, your immune system goes around your body and it patrols your body for anything that may be harmful to you. When it finds something harmful, it destroys it. And so your immune system is broken down into two categories. And the way I like to think about the immune system is similar to the army analogy, in which you have the intelligence officers and then the soldiers that actually do the killing.
Mm-hmm.
And so your immune system involves the innate immune system, which are very similar to the intelligence officers. They go around gathering information. Some of these examples include your natural killer cells, macrophages, neutrophils. The adaptive immune system is essentially similar to the soldiers. They are the frontline workers. And some of these examples include the CD8 cells, the CD4 cells, and also B lymphocytes.
So then if it can identify foreign items, including cancer cells, then why do people get cancer?
It's a very good question. And this is an area of active research. And there are many theories, but the leading theory is essentially centered around we don't think our immune system that's normally fighting cancer is doing a very good job. And the reason behind this is because of what we call tumor evasion.
Okay.
So essentially, the tumor becomes smarter and it becomes a toxic manipulator.
And how does that happen?
So there are different mechanisms, and they include the following. The first mechanism that the tumor cells become toxic manipulator is to actually manipulate itself so that the immune system, the innate, the adaptive, the investigators are not able to recognize it. So the body thinks it's a normal cell in the body.
Okay, so it kind of masks the cell.
Correct.
Interesting.
The second mechanism is that the cancer actually starts producing toxins that change the environment.
Wow.
And so what happens is even if the cells that are there to kill it are trying to kill it, it can't because the environment changes. Or it doesn't recognize it because the cells are not being as good as they can be.
They're almost like hypnotized, it sounds like.
Correct.
Wild. Okay.
And then the last mechanism that we think is behind this is that the cancer cells actually change the T cells. So the soldiers, they manipulate them so that they're not working as well, or they're working 24/7 and they're exhausted. And so they can't kill the cancer as well as we'd like them to.
Okay, so then how does immunotherapy work against all of this? It sounds like a setup,
Exactly. And so because we know that this is the way that cancer works, the treatments of the immunotherapies work by three different mechanisms.
Okay.
And the first mechanism is using checkpoint inhibitors. And what this means is essentially we are blocking the cancer cell's ability to manipulate the T cells so that they're not as exhausted and they continue to work as well as we'd like them to.
Okay.
So some of these common examples include PD-1 inhibitors or PD-L1 inhibitors would fall under this category. And a topic that I plan to cover in a separate video because it is very detailed. The second mechanism is to actually manipulate or change the T cells so that they work as well as we'd like them to. And this is the area that's near and dear to my heart because I spent 4 years at the NCI working on this. This mechanism is called adoptive cell therapy. And the two examples of this include CAR-based therapies. And the second way is T-cell-based therapies. And in a separate video, I'll go into detail about this.
That's great. Okay.
And then the last mechanism is to use specific proteins that we know the cancer cells may have, and we manipulate those to kind of induce the innate immune system. So the intelligence officers, we're basically giving them a tool to help them recognize these cancer cells. Some of these examples include using oncolytic viruses. So we use viruses to help attract the immune system to the area where the cancer is. We also use cancer vaccines, which fall under this category. I know there's been a huge hype about this recently. And there's other molecules you can use called biospecifics, where you just direct the attention of the immune system to that area.
Does not sound like it's similar to like chemotherapy or radiation, right?
Correct. It's not. It works through a different pathway.
Is one immune therapy better than the other?
So we don't actually know the answer to this. And in fact, we actually think that it's related to the type of cancer we're treating.
Yeah.
And also we think that and the data shows that they may actually work together to help kill cancer.
That's wonderful. Okay. So ultimately there's so many variables in cancers and different tissues behave differently too, I assume. So that's why it's not like a one size fit all.
Yeah. And it also depends on the mutation. So you could have different mutations that cause the immune system to recognize the cancer differently. So it's a very detailed topic.
Okay. So this sounds wonderful. I mean, there's got to be a catch, though. Is there some side effects about immune therapy?
Yeah. Unfortunately, there are.
Okay.
But unlike chemotherapy, which can cause you to lose your hair, for example, peripheral neuropathy, where you develop numbness and tingling in your fingers, most of the side effects associated with cancer immune therapy involves inflammatory response, so almost like an autoimmune.
Oh, okay.
So, for example, you can develop inflammation of your lungs and develop pneumonitis.
Wow.
There's also, you can get skin rashes where your T cells start attacking some of your cells in your skin. You can also get changes in your hormones. So you have a weight fluctuation and also hormone imbalance because your thyroid or your pituitary gland, which secrete hormones, are affected. And then obviously you have nausea and vomiting, which can happen with even chemo.
Sure.
And then diarrhea is another side effect where the immune cells actually are attacking the GI or intestines and stuff.
That sounds awful, but is it permanent or like how long do those side effects last for?
So it depends on the severity. Okay. In general, it is not permanent.
Okay.
Sometimes we just provide supportive care, meaning we give you fluids, we try to hydrate you if you're having diarrhea, we give you like inhalers if, let's say, you have the inflammation of the lungs happen.
Okay.
Other times we'll stop the treatment or we'll skip a dose. And in severe cases, we do give steroids because, again, what's happening is your immune system is just doing its job because that's what we're basically wanted to do.
But it starts cool it off a little bit.
Exactly. It starts kind of attacking the innocent bystanders, which is not the cancer itself.
Then what is the take-home message about immune therapy? Walk me through what I need to know.
So your immune system not only fights off infections, including viruses and bacteria, but it can also fight off cancer. However, in patients who develop cancer, we think that it's not doing as good of a job as it potentially can. And so therapeutic approaches that unleash the potential power of the immune system to fight cancer is termed cancer immune therapy.
Okay, the future looks bright. I know this affects a lot of people, and so I'm optimistic that we can beat cancer.
Exactly, because we know, unfortunately, our other modalities, including chemotherapy and radiation, in some cases are not doing a very good job. So this is a area of active research. There's a lot of data behind it, clinical trials, and it is an area that specifically I'm interested in, near and dear to my heart. Thank you so much for joining us for another episode of Sisters RX,
where we prescribe clarity in a world of medical noise.
Until next time,
cheers.